Dementia, it's a huge problem throughout the world, and one that is eventually going to affect you or somebody you love. But there's something that you can do about it. We're going to review 12 different things that you can start doing today that can help decrease your risk by developing dementia by over 40%. The first thing that you need to do is avoid head injuries. We found that for those who've suffered a moderate to severe head injury, you increase your risk of dementia by 2 to 4 times. Repeated brain injuries like those found in higher impact sports can increase this risk, but this gets especially dangerous the older we get. So if you're younger, wearing protective equipment is vital while participating in sports. As we get older, work on maintaining your balance, as falls are the leading cause of brain injury. If you're at higher risk of a fall, then use some sort of mobility assist device. Get your vision checked on a regular basis, and check with your doctor about any medications that you may be on that can increase your risk of falls and keep your living areas clear of clutter. The next step is to minimize your risk of diabetes or control it if you do. Several studies have shown that by having type 1 or type 2 diabetes, you significantly increase your risk of developing dementia. If you already have diabetes, work closely with your doctor and focus on your diet. If you don't yet have diabetes, do all you can to prevent it by avoiding refined carbohydrates and sugars and living a healthy lifestyle, as well as working on maintaining a healthy weight. The next step is working on controlling your blood pressure. High blood pressure increases your risk of stroke and causes damage to the arteries in your brain, affecting the way it can function. Those with high blood pressure are at a significant increased risk for dementia. So the first thing you need to do is check it. Now for most people, your goal is to have your blood pressure under 120/80, but this can vary depending on your age or other risk factors. If you have a high blood pressure though, get working on diet and lifestyle changes and visit with your doctor about taking medication if that isn't working. This next one I think is super interesting. They have found that poor hearing can have a significant impact on your risk of dementia. Hearing loss makes it much more difficult to engage with others. It becomes very socially isolating. This has been found to have a detrimental effect on the reserves that our brain have to function properly. So the first thing you need to do is protect your hearing. Avoid excessive noise and wear hearing protection when you can't. Now the great thing about this finding is that those who use hearing aids were able to eliminate this risk. So if you have a hearing loss, don't be proud and get you some hearing aids. The next step is something that you should work on yourself, but also you need to encourage in your community. We found that getting a better education early in life can reduce your risk of dementia. The more we learn, the more our brain forms connections, and the more connections we start with, the more reserves we have as those start to diminish later in life. So in your communities, do what you can do to encourage education, and in yourself, get as much education as you can. If you're past that stage of life, engage yourself in intellectual activities. Read, take some classes, learn to play an instrument, do some puzzles or other problem-solving games to keep your brain going. Next, you need to avoid excess use of alcohol. This has been a known issue for centuries, but more and more studies confirm it. The greatest risk has been found when you drink more than 21 drinks a week. Those who drink this much are found to have close to a 20% increased risk of dementia over those who don't. So if you're going to drink, keep your consumption to moderate or less. The next one you're going to find in every health recommendation that is out there. So if you haven't done it already, stop smoking. Smoking increases your risk of every bad health issue that you can have, and dementia is no different. Smoking itself has been found to increase your risk of Alzheimer's by up to 40%. So if you're looking for another reason to stop smoking, then there you go. The next one goes along a little with smoking, but sometimes can be harder to control. There's been found a significant increased risk of developing dementia the more that you are exposed to air pollution. This includes community air pollution as well as exposure to secondhand smoke. So advocating for policies that encourage cleaner air, as well as avoiding secondhand smoke, can go far in decreasing your risk. The next thing to focus on is working on losing weight. Obesity, defined as having a BMI over 30, has been found to also increase your risk for dementia. But the best thing about that statistic is that weight loss has also been found to improve your memory. So focus on taking those steps to get a good healthy weight. There are so many health improvements that you will have, and decreasing your risk of dementia is one of them. Now the next one you may not want to hear, but you need to get out there and exercise. A number of studies have shown that staying physically active and exercising decrease your risk of dementia. Exercise likely triggers chemicals in the body and brain that help improve mood, memory, and learning. So shoot for at least 150 minutes a week of moderate intensity exercise. Get out there for a brisk walk, sweat a little, and see how it improves your overall health, as well as helps you to avoid dementia. The next thing you need to watch for is depression. People who have dementia are more likely to develop depression, but we've also seen that those who have depression are more likely to develop dementia. There's some thought that depression can speed up aging and shrinking of your brain. Also, those who are depressed are less likely to do things that will stimulate their brains like exercise and interact with others. So watch for signs of depression in yourself or those that you're around and seek help. The last thing you need to focus on is maintaining frequent social contacts. Several studies have shown that more frequent social contact the older we get helps decrease our risk of developing dementia. This is an area that sometimes we feel like may or not have as much control over. However, finding social outlets and opportunities to be able to interact with others in healthy ways is vital to our overall health in any stage of life, but especially as we get older. Dementia is a complex condition and there isn't a way to completely prevent it. But we found that by focusing on the things that we can control, like the areas we discussed today, can give us the best chance of maintaining our mental clarity throughout life. If you want to learn a little bit more about what signs that you need to be watching out for if you think you may have Alzheimer's, then I want you to click on this video right here. But for everybody else, we just want to thank you for spending some time with us here at Family Med, and we hope to see you in the next video.